Hello everyone, this is Dr. Nitin and I welcome you to another episode of Health Talk. So this is a channel which is dedicated for making people aware about their various health conditions and giving guidance from various medical experts. So with another medical expert, we are here with another new episode of Health Talk. If you are new to this channel, please subscribe to this channel so that you get notifications when we upload next interview with next health expert. So let's start with today's episode. And in today's episode, we have a medical expert, Dr. Shekhar Phulpagar from Thane, Maharashtra, who is basically a consulting allopathic physician, and he turned into a Ayurvedic expert. So with his clinical practice and experience of more than 35 years, he has developed and patented a Ayurvedic formulation which is helping various respiratory and breathing problems. And particularly in period of COVID-19, it has helped various patients across various parts of the India. And with his products, his allopathic practice, he has helped more than thousands of people in past few years. So, Dr. Shekhar Phulpagar, I welcome you to the episode of Health Talk. We are delighted to have you on this channel.
Thank you very much. I'm Dr. Shekhar Phulpagar. I have done my MBBS and diploma in public health as well as public diploma in hospital administration. I was attached to the BMC health department for last 30 years, and I have in the clinical touch for more than 35 years. Well,
okay.
Now you must be wondering on this aspect.
Yes, thank you, doctor, for your kind introduction. We are just curious, our audience is curious to know, like, why did you choose to become a doctor?
And to very frank and frank to myself and loyal to myself, I don't wish to become a doctor. I wanted to do a world tour. I wanted to see the world. But unfortunately or fortunately, I was not able to choose my first two choices of my career. Like my first choice was to become an airline pilot, for which I was needing around 50,000 rupees at that time in 1978 or 80, in between that period. So in that period, that 50,000 was quite high. And for that, I spent a few days in the training ship of Rajendra for after passing out Jahaz Bhavan, the exam from Jahaz Bhavan. But there also I found it, I was not comfortable. So ultimately my third choice was to become a doctor. And I choose that. And now at this end of my life, I don't repent for my decision because I have done more than enough, more than at satisfactory level. I'm satisfied with my life. And I am very much proud of myself. My journey as a doctor started. I delivered my duty as a doctor wholeheartedly. I don't repent for getting airline job or becoming captain of a merchant navy. No.
That's very interesting story, doctor. It's definitely you have done some various hardship decisions, and with all those decisions, you are here. You are serving the patients, and that's we thank you for that because you are serving the mankind. So, doctor, what makes you feel inspired working in respiratory medicine?
In the year 2020, pandemic was it at peak. Death rate was 3.61% and transmission rate was high. As an administrator and diploma holder in preventive medicine, I thought that bringing death rate below 1 will bring down the transmission rate and pandemic could be controlled. When I tried to study the causes of death, it was clicked that most deaths have occurred early in the morning, as well as with common cause of lung fibrosis. I started wondering why virus, when it has entered in the body, why only lungs are getting fibrous? Why not other organs? One more case in my family was saved with use of essential oils earlier, and I was trying few of the essential oils in the treatment of AIDS virus, and with limited success by raising CD3 and CD4 count of patient. Patient is still alive after 18 years. Few patients with respiratory symptoms become asymptomatic within 4 days, which inspired me to work in respiratory management of patients.
Okay. So, doctor, it's very, I'm curious to know, like you are being an allopathic doctor, how did you turn to Ayurvedic product, and what is that prompted you to do research in Ayurveda? Can you
Right.
guide us on that?
Right. Because it happened like this. Some 15-20 years back, I had been to my native place with intention to set up one phytochemical extraction plant. I had a big land. I was having a big land of around 10 acres at my native place, which is quite near to Bombay, which is not very far away from Bombay. And since I thought something has to be done for that land too, I thought perhaps my next generation will not visit that native place unless and until I do something economically viable. So being in a medical practice, I thought the extraction of phyto better option. Since some of the phytochemicals which are there in that area abundantly, naturally occurring, like gallic acid. It is one of the precursor drug for many allopathic antibiotics. So extraction of gallic acid was my intention. But what I found while studying this phytochemicals, I found out that many phytochemicals has got medicinal values, and all the modern medicine are derived from the phytochemicals. So, such wonder information draws my attention towards origin of modern medicine in Ayurvedic phytochemicals. When I noticed the magical changes in patients using oxylar, I started systematic investigation with modern laboratories and developed products from phytochemicals. Few incidences behind my turning towards essential oil and study in Ayurvedic science was thinking of setting up phytochemical extraction plant, studying phytochemicals of medicinal use, some natural antivirals, example like curcumins, role of benzene ring and its presence in phytochemicals. Example, curcumin now has double benzene ring, which is the only natural ingredient having double benzene ring. All other ingredients are having single benzene ring, and all antibiotics is having benzene ring acid base. Gallic acid is having benzene ring. This information is little bit not very known to the medical fraternity, like doctors. Doctors use the medicine, but they don't go into the manufacturing of medicine. They don't see the chemical part of the medicine. That is the part which is neglected in allopathic science, which my attention went to that side, and that leads to development of the allopathic modern oxygen.
Thank you, doctor. It was a really interesting journey, but I still doubt, like it was not an easy journey as you told in last few minutes. There must have been various challenges, various problems and hurdles. So
Yes, yes.
can you tell us about that?
Yes, sure. There are many hurdles while making progress to achieve our goal, like criticism. from the near and dear ones. So it is not easy. It is not easy that allopathic doctors, they don't believe in Ayurveda. That is the most common phenomenon which I observed, which I come across. My friends from allopathic science, those who are doctors from allopathic science, they are not ready to believe. And when I told them, when you are using like IV fluids, normal saline or DNS, which has got only water and glucose and salt, which is abundantly present in nature. So do you think that it is an allopathic medicine or Ayurvedic medicine? Because ingredients are all Ayurvedic. Water is Ayurvedic. Or sugar or salt, they are also present in nature. So when you are using that, are you using the allopathic medicine or are you using the Ayurvedic medicine? So my question baffled them.
Yeah, right, doctor, you said it correctly. So whenever there is something new happening, there is some new invention happening, there will be some kind of resistance. So your story, your path, your journey will definitely guide and motivate the new generation so that they can also come up with some new inventions which will be helpful to the mankind. So I want to ask you, like, though there might be some criticism and some opposition from some people, but I'm sure there you must have got some support from some people who might have supported you in this journey. There
There are
might be some
many,
organization to whom you want to thank.
there are many people who supported the noble cause. Few of them, I must mention their names, like Mr. Manoj Awasthi. He is a pharmaceutical manager in a big company. He guided the proper way. He selected the companies for research. And second person is my wife. She helped me in every aspect. She helped me to conduct the trials for herself, which nobody takes risk. So she risks her life. Similarly, I must thank to Dr. Shekhar Phulpagar, who is the principal of Gnan Sadhana College, for telling his daughter to accept the medicine without taking any other medicine when she was positive, confirmed positive case. So that is really hats off to him. Similarly, there are many peoples like Bhalirao family from Kharegaon. Those in their family, there were around 40 patients who were at risk of developing complications because there was death due to in the pandemic, from the pandemic in their family. Similarly, in Nagpur, Mr. Ambade was my distant relative, and his family was when he suffered with this pandemic infection. He took the medicine from Bombay, from Thana, and he saved his family. So, inspired by all this efforts of all these people, I was successful in developing this medicine, and I must say thanks. I must take this opportunity to say thank you to them, because their efforts, their persistent efforts only helped me to get these products ahead, to get this property of this product to be known to everyone now.
That's
There are
very
many
nice.
more. I cannot quote a name of each and every one here, but there are n number of people who help in way or other way in their life in this journey of medicine.
That's very nice, doctor. Obviously, without support of these people, we cannot move ahead. So I also thank on your behalf to these people as they supported you. So because of this support, you have reached to this stage where you have developed and improved your medicine, and now you have got the patent for the medicine, which is helping many hundreds and thousands of people. So people are usually not aware about asthma or any breathing problems or any respiratory condition, and usually they don't give much focus or attention to their breathing problems until that gets very discomforting or some kind of disease or complication develops. So what, according to you, what do you think, what is the biggest mistake people make about their health?
Right. So, according to me, the biggest mistake people make about their respiratory health is taking steam inhalation using electric current. Now, steam inhalation can be taken by natural way, by just boiling the water in on the heater or some gas like that. But using electric current is definitely a wrong thing, because that electric steam gives continuous heat, and water temperature is above 60 degrees centigrade all the time, which does not kill the viruses, because viruses need 73 degrees centigrade heat. So what happens with that 50 to 60 degrees centigrade vapors? It is only heat coagulation of protein which occurs. Heat coagulation, since body is made up of protein, lungs is made of proteins. So what happens? That lungs epithelium gets destroyed. Lungs epithelium is exposed to the heat, and which in turn get coagulated, and which in turn get into fibrosis, because every tissue is replaced by fibrous tissue according to the lung pathology, or according to the pathology. For even in surgery, even in any, if there is damage due to anything to the body, the tissue is always replaced by fibrous tissue. And so this steam, because of this steam, only lungs are getting fibrous and not other organs. That is what I feel strongly. And I want everybody to make aware of it, because see, what I observed that all the people, those who have stopped taking steam inhalation with electric machine, they have not developed any complication. They are free from the virus.
Okay, that's very interesting finding, doctor. And I request all the medical communities also to take note of this point and also guide their patients accordingly. So, doctor,
What I observed that doctors mostly recommend steam inhalation, and people, layman, they don't defy doctor, or they don't disagree with doctor. They accept their verdict blindly, and what happens in turn, that they land up in trouble, because the respiratory epithelium which has cilia around it, that ciliary movement throws away the virus laden, bacteria laden mucus out of the throat towards the throat. It doesn't allow, that cilia doesn't allow virus, bacteria, or fungus to enter into the larynx below the laryngeal level, below the vocal cords. But when that tissue or epithelium or that cilia is destroyed, that virus, bacteria, or fungus goes into the alveoli. And alveoli, where the oxygenation takes place, it disturbs the oxygenation. That is why we get the hypoxia. That is why we develop complications due to hypoxia, and patient mortality occurs. If you want to prevent that mortality, we have to keep the respiratory tract open. We have to keep the oxygen lines open. And unfortunately, my doctor friends are not aware of this fact. They are suggesting to take the steam inhalation, which is now the traditional steam inhalation is replaced by electrical steam inhalation. Now that electrical machine is giving the steam continuously, which is causing the problem.
Yes. So rightly said, doctor. Like when people or the patients get some instruction from doctor, they follow it as per their own modification. So what I see from your point is that doctors should also advise to their patients in specific manner, and if possible, just demonstrate the method of stream inhalation in their clinic, or even the patient should also follow the doctor advice as recommended. They should not do some kind of different experiments with the advice, because as
Right.
you, yeah, as you highlighted that following some kind of things is not helping the condition to improve, but it's in fact worsening the condition. So thank you for highlighting that. And when people are coming with this kind of conditions, what kind of advice do you have for the people when they come with this kind of respiratory problems? Do you have some suggestions which can help these people to
Definitely.
manage their breathing problems?
Definitely, I suggest people not to take steam inhalation unless and until it is absolutely essential. Because steam has only one advantage over other things, and that advantage is like it relieves you from the congestion. But nowadays there are many other modern medicine which is available for decongestion, which is costing around 50 rupees. So I don't think a person should expose his life or expose to the threat of life just for 50 rupees. Instead, he can use those medicine and get himself decongested. There is no need of using steam inhalation. If at all one has to use the steam inhalation, they should try the traditional methods, not the electric current steam inhalation. That device is giving the problem.
Okay.
So similarly, what other things I'll suggest is stop the steam. Don't take the steam inhalation. If damage goes beyond repairable stage, then irreversible mortality can set in. Respiratory symptoms should not be ignored. In fact, oxidation reaction is important for removing pathogens from body. So oxygen is required by the body, which in turn is oxygen is provided at free of cost with healthy lungs. So if we try to keep the lungs clean and healthy, we can give the oxygen at free of cost almost. While when we are looking for oxygen beds or something of that sort, we are needing trained person to give oxygen. We are needing oxygen beds. We are needing oxygen. These are all not possible in remote areas. It is difficult, and trained person cannot be made available everywhere in every corner of the country.
Okay. So this channel, basically the objective of this channel is to help and guide people to get best healthcare advice and services wherever they are, and whatever it may be the condition. So, Dr. Shekhar, I wanted to ask you, like, if somebody wants to visit your clinic, so what kind of services that you provide in your clinic?
And now, to be very frank, I give only consultation, and I don't examine patients in my clinic. I have got my own hospital. I was having my own hospital, where I used to admit the patient. But nowadays, since I want to dedicate my time to this product, I'm not keen on examining the patient. But those who are seeking my advice, I give them free consultation online anytime. I have displayed my number on the product. If anyone is having any problem, that person can talk to me over the phone at any time, at any day, 24/7. My services is available to the needy people.
Okay. So, doctor, can you tell some more thing about your this product, how it is helping people, and if somebody wants to utilize this product for their respiratory problems, from where they can get it and how it will help them?
Yes. This product is helping the people in recovering from the lung infection. If a person is suffering from lung infection of any origin, like viral, bacterial, or fungal, that infection can be controlled. This product helps to control those infections. In fact, if a person is suffering from disease other than the lung infection of the lung, then this product might not help. But as far as infection, that is live pathogens are involved, live pathogens are covered by this medicine effectively within hours, which is not possible by any other medicine or any other. This is my observation, persistent observation for more than 1,000 patients. And I have come to the conclusion. The same findings were given by the pharmaceutical companies like Panacea Biotech and Midas Pharma company. Those who are involved, these companies are involved in various research activities on this product. So even these companies, they have observed the same trend, the trend which was observed initially by me. And if one uses this product, it is very easy to use, like this. This is the product, which is like inhaler. Why I have chosen inhaler? Why not other mode of giving this medicine? Because while if I use the other mode like spray, nasal spray or oral spray, it doesn't cross the vocal cord. It doesn't reach the alveolar level. While when you inhale this, the vapors can reach beyond the vocal cord up to the alveolar level, which is possible only with this device. So inhaler is only the device, not the medicine. Inhaler is only the device. So don't compare this inhaler with any other inhaler. That is what I say. Because though external device look the same, internal effect, internal medicine is different, and you cannot compare those effects. While this product gives curative effect, other products gives only a symptomatic effect, like cooling the air in the nasal nose, which is the effect of menthol. While this this is a medicine which gives curative effect against the pathogens, while other inhalers doesn't give curative effect against pathogens. That is the biggest difference. I feel patient's life can be saved effectively with use of this inhaler, and if the life is saved, nothing can be compared with the saving of life. That is unparalleled. There are many people think that this may be the gimmick. No, this is not the gimmick. This company is registered with so many licenses and having so many different permissions from different agencies. This is not the company which is going to be a fly-by-night company, just giving something and running away with the money. Basically, I don't need the money. Basically, I'm satisfied with my life. I have earned enough in my 35 years, which is sufficient for me to lead my rest of the life. I don't need to do any gimmick. I don't need to do any thing which is not permissible. I want to lead the life which is quite normal, healthy, legally. I don't want to do some illegal things. That is what I wish. But at the same time, I should not go down to the pressure of other people, those who have belief but no proof. I want to believe with proof. I don't want to believe anything which doesn't, my internal posture doesn't permit me to believe. This product is quite useful in the way, like any living particle require water molecule, it requires food, it requires air for its survival. This medicine has got very strong hygroscopic action, which withdraws water content from the body of virus. It withdraws water content from the body of pathogens. Pathogens are very tiny organisms. Like viruses on the tip of the needle, 60 lakhs viruses can be mounted. If you use, and they don't have any external mechanism like skin or bone in their body. So naturally it is their asset, they can penetrate anywhere, but it is their weak point, they can be killed easily. So if the human race, we want to survive the human race, we have to kill them. We have to kill the pathogens. There is no way. If any philanthropic person, one person who thinks that it is not correct to kill the pathogens, then he is wrong, what I say, because survival is of human being is more important than survival of any other pathogen. Okay. Anything else, sir?
So I see that from your discussion that you have gone through rigorous clinical trials with the help of various pharmaceuticals. You have taken appropriate licenses from FDA. You got patent, and it's also helping the people around. So I'm sure your patients are definitely getting the benefits, and particularly in this period of pandemic, when there are limited resources, I think your medicine is definitely going to help many more patients and many more people, and that too in a more efficient way and more simplistic manner. So I surely wish all the best for your venture. If you are audience of this channel and if you like this video, please do share with your family members so that they also come to know about this respiratory conditions and how it causes us various damages. And you will also get some guidance from this video how you can get help from Dr. Shekhar and through his innovative Ayurvedic products, which can help you in overcoming various respiratory infections. So, if you have any questions or if you want to ask anything, you can put your questions in the comment section. And so if you are a patient who is looking for any kind of support from the doctor, you will get the details about Dr. Shekhar's clinic in the description section. From there, you can contact him, whichever part of country you are in. He will be able to guide you on your health condition. And if you are a medical practitioner and if you want to know more about this medicine, and if you want to work collaboratively with Dr. Shekhar, you can also get the details in the description section. So with this, I would like to end today's session. So if I request you, all of you again, that if you are interested in various health condition knowledge, and if you want to get those various tips and guidances about health conditions and how you can improve your health in a natural way. So please do subscribe and like this channel and do share this video with your family and friends so that we also get motivation and support from you and we take all our mission of helping these people to many more people. So with this, I'll end today's session. Thank you, Dr. Shekhar, and thank you all the audience.
Thank you, Dr. Nathan. Thank you very much.